Okay, hello everyone. We'll get started. My name is Patrick Wade. I'm from the Champaign County Joint Information Center. This is our news briefing for May 18th. Today we are talking about the community-based testing site that will be opening at Marketplace Mall in Champaign. That was announced on Friday. We're going to provide you with some more details about that today. We have a number of speakers and I'll introduce them as they come up on our agenda over here. So we will get started today with Champaign-Urbana Public Health Administrator Julie Pride. And let me make sure I have her unmuted. Okay, Julie, go ahead.
Good morning. We are currently at 387 cases with 19 current outbreaks. An outbreak is 2 or more cases in one location. We currently have 174 people in isolation and close to 700 people in quarantine. We have 3 hospitalized and we still have the 7 deaths, unfortunately. We have completed in our county to date around a little over 8,400 tests. We're encouraging everyone to go out to the drive-through testing site. We're excited about that. It'll be at Marketplace Mall from 8 to 4 while supplies last, and it'll be going 7 days a week. So we hope to see those testing numbers increase a lot.
Okay, thank you, Julie. Sheriff Harmon, we'll go to you next. You're going to talk about the state and local cooperation and also some other details.
Thanks, Pat. Good morning, everyone. I'd like to start out by thanking our local healthcare community, especially Carle Hospital, for all the work they've done so far helping our community combat COVID-19. When our community leaders came together to form a plan of action, Carle was right there with us. They've been very instrumental in testing those with signs and symptoms, as well as first responders and other essential employees. Today in no way marks the end of that collaboration, but rather a continuation of that collaboration. I'd also like to take a second to thank the state of Illinois for recognizing the need for increased COVID-19 testing in Champaign County and stepping up to help supplement our local resources. This cooperation between state and local agencies ensures that we have, that we're serving and protecting residents to the best ways possible. I know not all of our elected officials could be here today, but I want to say that we are all very appreciative of the state's efforts to help bolster our local response. We are all in on this and thankful for the support. Lastly, I realize we're all looking to get back to some sense of normalcy, and this increased testing will help us continue on our path to doing that. The better we know the extent of COVID-19 in our community, the more quickly we can get back to our routines. So I encourage everyone to take advantage of this opportunity for the good of our community.
Thank you, Sheriff. We also have the Director of the Illinois Department of Public Health joining us today, Dr. Ann Ghazi. So Dr. Ezike will talk about the importance of testing and the benefits of testing. So Dr. Ezike, please go ahead.
Good morning, and thank you for having me. And I'm so proud to be in the company of these state and local leaders. I'm so excited for the launch of this community-based testing site here in Champaign. I think everyone knows, but it bears repeating. Testing is critical. It's critical for many, many reasons, and we're expanding our ability each day through efforts just like this one with this new community-based testing site. One of the goals of testing is to have rapid identification of cases, which should translate to early observation and evaluation of people who are positive, as well as immediate isolation of individuals. All of this with the goal to help prevent additional spread. More readily available testing will help us determine if close contacts to confirmed cases have been infected. Testing is also important for the bigger public health picture so we can hone our mitigation efforts, do targeted interventions, and learn about how the virus is spreading and to whom. And of course, we need more testing to safely reopen our communities and successfully maintain a high level of protection as we move into phase 3 and phase 4 of the Restore Illinois plan. While it's not enough to just have the testing capacity, we actually have to make sure that the people of the community avail themselves of that capacity. And so it's especially important for our communities of color, our African American and our Latinx communities who are being disproportionately impacted by this virus. Because of increased testing capacity, we've been able to expand testing eligibility for the following groups of people: all frontline and essential workers, including workers in grocery stores, pharmacies, restaurants, gas stations, public utilities, childcare, factories, elder care, sanitation, all healthcare workers, including those who provide home health services, nursing home residents and staff, all first responders, our paramedics, our EMTs, law enforcement officers, firefighters, all those working in correctional facilities such as jails and prisons, of course, those with a compromised immune system or a chronic condition, as well as anyone with COVID-like symptoms. And for sure, if you've had contact with a confirmed COVID-19 case, whether you've had symptoms or not, please get a test as well. Remember, the testing is free. You don't need an appointment. You don't need a doctor's referral. You don't need insurance. You will receive a flyer at the site that will explain what you should do while you're waiting for your results, as well as additional information. It'll also include the phone number that will be used to call you with your results. Please answer when this call comes through. Your results will not be left on the voicemail, so they will need to speak to an actual individual, and they'll make several attempts to call you. Once again, I want to encourage people in the community, please take advantage of this service that's here, and let's use this as part of our road to recover for the entire state of Illinois, starting with Champaign. Thank you. And with that, I'll turn it back over to you, Patrick.
Thank you, Dr. Ezike. Next, I think Alicia Payton Addo, the director of the Illinois Emergency Management Agency, has joined us today. So Alicia, please go ahead.
Thank you, Patrick. And thank you, Dr. Ezike and Sheriff and all the others that have joined us today here, to include the Champaign County Health Department and the members of the Champaign County Emergency Operations Center for the opportunity to discuss the new community-based testing site that will open tomorrow. Expanding COVID-19 testing capabilities in the state of Illinois is crucial part, as you heard Dr. Ezike mention earlier, to the Restore Illinois. And to date, the state has opened at 8 community-based testing sites, with more slated to open in the coming days. As more testing supplies become available and the lab capacity expands, we are able to bring more testing sites to our communities throughout the state. Several of these factors that go into determining a community-based testing site is really about the ability to conduct drive-through services. And other factors include proximity to major thoroughfares, the population density, the racial and the ethnic diversity. And keep in mind, none of this is possible without the availability of testing supplies and lab capacity. These testing sites are extremely valuable resource to our state, and I wish there was enough testing supplies to put in every county, but at this point, we simply don't have all the materials we need. So we strongly encourage our communities to take advantage of this free service that's in your backyard. Without greater testing, it's difficult for us to know who's infected with the virus, and this could mean a person who thinks they're healthy because they don't exhibit symptoms may unknowingly pass the virus to someone else and potentially have deadly consequences. As you heard Dr. Ezike say earlier, and I feel like it's important that we reiterate this, it's never been easier to get answers to your health care today. And everyone who shows symptoms of the virus can get tested. So if you're a person that is a grocery store worker, a gas station employee, a daycare worker, utility worker, factory worker, pharmacy employee, or are part of state and local government, and your employee, correctional officers, first responders, and healthcare workers, you're eligible to go and be tested. Additionally, anyone who has been exposed to someone with COVID-19 or has an underlying chronic illness or a weakened immune system is also welcome to utilize our community-based testing site. I want you to know I personally go through these community-based testing sites, and I can tell you that they're simple, they're painless, and they're free. And this is an invaluable health information that you can help to make an educated decision about protecting yourself and your family in your community. So Patrick, at this time, I think I'd like to turn it back over to you.
Okay, thank you very much, Director Payton Addo. Next, joining us today is Brigadier General Richard Neely from the Illinois National Guard, who will discuss the National Guard's role in the community-based testing site. So, General Neely, please go ahead.
Good morning. Thank you again, Patrick, for that introduction. I am General Rich Neely, the commander for the Illinois National Guard. And thank you all for joining us today as we prepare to open the 9th community-based testing site ran by the National Guard here in Champaign. And in fact, I'm on site this morning, joining the troops out here as they open the site up. We're out at the Marketplace Mall, as was mentioned earlier. Although the National Guard is running the test site, we are really working for the incident commander who's on site on location. And as you heard earlier, the Illinois Department of Public Health, the Illinois Emergency Management Agency, all come together, bringing testing and capabilities and kits together in this collaborative effort to ensure that we're able to serve the citizens of Illinois. When a patron or a citizen arrives here at the test site, they can be expected to be greeted by someone in uniform like myself. And they'll ask a few simple questions along with possibly a public health person from the local area. And then we'll be directed into a particular lane for testing. The National Guard personnel at the test site will direct the vehicles and will be looking to ensure people are driving slowly into the test lanes to ensure safety. Once in the lane, testing lane, the guardsman or woman will ask the citizen to go ahead and shut off their vehicle so they can capture information. They'll be capturing information on a very simple form like this. The person will be, they'll be either asked to keep their window rolled up and they'll speak through the window, or they'll ask them to roll down their back window and they'll ask for information as they complete that form. The reason that they have them either leave the window up or ask through the rear window is to ensure there's limited exposure to the guardsman that's actually there asking those questions to fill out the form. The form will be used to send in the test results and the information captured within that form will ensure that we have contact information, understand address, and all those important data points that are needed to administer the test. Again, prior to the test, they'll have you move forward again with your vehicle and shut your vehicle off, again, for safety reasons. And then the test will be administered. What we're using at this site, at this location, is a self-test. And the person at the test location will actually hand the test kit over to the person being tested and explain to them how to administer the test. And through that process, we'll also be handing out a guide that Dr. Ezike mentioned earlier for each person coming in to be tested. It talks about some preventive methods as well as the process that they can expect to go through as the test gets resolved. Finally, I'd just like to remind everyone that Illinois National Guard are service members that live in your community. They're part-time Air Force and Army reservists that deploy around the world to fight America's wars. However, when the state calls and the citizens are in need of help, we come out of our full-time positions, out of our civilian lives, and put the uniform on and lace up our combat boots to support our communities and our neighbors. Currently, we have a little over 1,200 people deployed across the state of Illinois in response to the COVID-19. And in addition to over 1,000 people deployed around the world, supporting the war across the world. So with that, I'll pause and I'll hand that back to you, Patrick. Thank you again for joining us today.
Thank you very much. Our next speaker is Arielle Phillips, a public health nurse at the Champaign-Urbana Public Health District.
Hey, good morning. My name is Arielle. I'm just going to explain the nasal swab process. With this, since it's self-administered, it should be quick and painless, but there shouldn't really be a lot of pain at all. You insert the swab into the nose. You'll have it touch the nasal floor, and then swab 3 times, and then remove. And then you want to be really sure to not have the swab touch anything else or cross-contaminate the swab. And yeah, you'll insert it again 1 inch, and that's it. And I'll hand it back to you, Patrick.
Thank you, Arielle. We're going to go back to Champaign County Sheriff Dustin Harmon. He's going to describe the traffic flow for the site.
Thanks, Matt. So yeah, how do we get there? So I want to be tested. How do I get there? Marketplace Mall parking lot is a huge place. So as the general mentioned earlier, Marketplace Mall's parking lot is where this is occurring at. So the best way to get there is from Market Street at Wilbur Avenue. So on the east side, that's Market Street. You can either come from the north or the south on Market Street. And Wilbur Avenue, you can turn west into the Marketplace Mall parking lot. This is the only entrance to the testing site, and so it's important that you use that entrance or else you're going to be driving all around the place. A traffic pattern has been set up to help you navigate the process once you arrive. Highly visible signs have been set up to help you navigate the facility with ease. So please take care, follow these signs, as this will help ensure you're in and out as quickly as possible. That's our goal, in and out as quickly as possible, but also being as thorough as possible. We do expect some degree of wait times at the site, so it's important that you allow plenty of time to visit and remain in your vehicle when you enter the testing site.
Thank you, Sheriff. Next, joining us is Lucia Maldonado, the Urbana School District Latino Family Liaison, and she's going to tell us about what the community can do to help us out. So Lucia, please go ahead.
Thank you, and good morning to all. So as we all know, the number of Latinos getting testing positive keeps increasing. So if you allow me, I'm gonna direct my message to Latinos in the area. Latinos, please go get tested. As we heard today, there are some more opportunities now. There are different sites to get tested. So please don't wait and go get tested. If you are working from home, but you have family members that are leaving your home to go work, please go get tested. If your family members are leaving, are going to work, please make sure that they get tested. As you heard today, we have sites now where you can get other people do the test, and we have sites where you can go and do it yourself. So you have options, and you can choose. If you work on construction, in roofing, food service, food trucks, daycare centers, factories, cleaning services, landscaping, we all know where Latinos are working, so please go get tested. If you allow me, I would like to say this message in Spanish for those who don't speak or understand English. Latinos, por favor, ustedes ya escucharon en esta información que se dio antes. Hay nuevas opciones para que ustedes puedan hacerse el examen. Pueden ir a un lugar donde les hagan el examen. Pueden ir a otro lugar donde les den lo necesario para que ustedes se hagan el examen. Por favor, vayan a hacerse el examen. Toma solamente unos minutos. Si ustedes están trabajando en casa, vayan a hacerse el examen. Si tienen familiares que están trabajando fuera de su casa y regresan a su casa después del trabajo, vayan por favor a hacerse el examen. Si trabajan en construcción, en los ruferos, los que trabajan en los restaurantes, en los food trucks, en limpieza, en los centros de cuidados de niños, en jardinería, todos tenemos que hacernos el examen. Es muy necesario que todos estemos seguros que no estamos contagiados para no seguir incrementando el número. El número de latinos contagiados ahora es 45% de los casos totales en Champaign. Entonces es muy importante, por favor, que se hagan el examen. We are all together in this. Estamos juntos en esto. So please go get tested. Thank you.
And thank you. So that concludes our speakers today. I just want to reiterate, the testing site will open tomorrow. It's open 8 a.m. to 4 p.m. While daily supplies last, and it'll be at Marketplace Mall, which is located at 2000 North Neal Street in Champaign. So at this time, we would like to open it up to questions from our participants, and I have a very long list of participants today. So the way I'd like to do this is I will go down the list, and in the interest of time, I think we'll have to limit it to one question and then one follow-up question today once we call on you. I'm also going to call on everyone, and I recognize that some of our participants are from our local partner agencies here. So if you don't have a question, obviously that's completely fine. Just let us know and we'll move on. And then also it'll help us out if you direct your question to a specific person, just to keep things running more smoothly. So I'm just going to go straight down my list. And the first person on my list is Brian Brower. If you have a question, let us know. If you don't, just let us know that too, and we'll move on. Okay, hearing nothing from Brian. The next person on my list is Kael Fleming. Kael, do you have a question?
I do not. Thank you very much.
Okay, thank you. Christine Herman.
Hi, Dr. Ezike, when we say that frontline workers can get tested, or, essential workers, how frequently are we talking about? Is this weekly? Is it up to the person?
That's a great question. Thank you. So ideally, we will get to the point in our state where everybody and anybody can get a test anytime they want. I think we don't have official guidance on what should be the cadence of repeat testing. Every week or every other week seems a good place to start. So there's no specific guidance from IDPH. Definitely whatever cadence seems appropriate for the individuals. And as long as we have that testing site at Champaign, I feel people should take advantage of the opportunity.
And when we move into phase 3 and more people are called back to work, will they also be eligible the same way that grocery store workers and others are eligible now?
Right. So essential workers, we're trying to increase the capacity as we get more people who will be, resuming work. And so that is the goal, that we will have more and more opportunities for people to get tested, so that people can feel safe, that they can get tested before they go to work, that they can know their status before they resume work. Yeah, all of these things are high priorities for this administration and for the Department of Public Health to make sure that testing is front and center as we restore and reopen Illinois.
Thank you.
Okay, thank you. Next is Courtney Bunting.
Hi, this question is for Dr. Ezike. President Trump has said, this is a little off topic from the testing site, by the way, but it's just about wearing masks in general, because a lot of people have been at rallies not wearing masks, and some are saying that it's more of a political statement than a means of protection. Is there any new data now showing that masks are protecting more than we originally thought, and is it still recommended for everyone to wear them?
It is absolutely recommended. It's part of the executive order to be wearing a face covering when you're going to, be in contact with people. So that's almost any time that you're outside of your home. We know that there are different levels of protection. We know that the N95 is the gold standard that we're reserving for our healthcare professionals who are performing very high risk procedures that cause the aerosolization of particles. We know that as you get down to the surgical or the procedure mask, it will still filter out particles and aerosols and droplets, and maybe less than the N95. And then the face covering might not be the same as the surgical mask or the N95, but we know that it will filter some particles. And so we want to get as much protection as we can. It's also protecting the public around you as you cough, talk, sneeze. Those those droplets would be, expelled from your mouth and nose. And so you are keeping those to yourself and trying to protect the public around you. So yes, we want to continue to use those very simple measures which can protect people around us. And so we will absolutely continue to recommend that and support people's use of those items.
Okay, this may be a question for you as well, then just one more, and I apologize if this is taking up too much time, but the other question I just have is if once you guys do run out with these tests, I know that you said you'll keep going until you do run out, but what will be the effort then to restock? Is the plan to keep this testing happening at that specific site for as long as possible? Like how will you get a second shipment in, or how will that work?
So we obviously have a set capacity at each of our community-based testing site, and after that, that is the conclusion for that day. But that is one of many sites that are available, and we have FQHCs around the state that also are providing testing. So it's not that that is the only place to get testing. There are many. There are hundreds of sites around the state where people can avail themselves of testing opportunities.
Thank you so much.
Okay, thank you. Dennis Robertson, I have you next. Okay, hearing nothing from Dennis. Deb Pressey. Okay, hearing nothing from Deb. Kenya Ramirez, you are next on my list.
No question.
Okay, thank you, Kenya. Jump down here to Taylor Deckert.
No questions.
Okay. Todd Hitt, you are next on my list. Hearing nothing from Todd. So I have a couple call-in users here whose names are not listed. So I have a 766 number. If you have a question, go ahead. Okay, hearing nothing. I have another 312 area code 805 number. Hearing nothing. I also have a person listed as M. Arnold. Okay, and hearing nothing. So is there anyone who I did not call on who has a question they would like to ask?
Patrick, I have a couple more if I could. I just want to know who's going to analyze these tests. What's the turnaround time expected for these results?
Yep, go ahead, Julia. I was just going to say if you wanted to.
Sure. So the laboratory that we've been using for all of our other testing sites, which is the Carl expanded laboratory here in Urbana, they will be doing it, and the results take less than 24 hours to come back.
And what's the idea behind building this new site versus further supplementing the many other existing test sites in Champaign County?
Those are also continuing as well.
Okay, so is the goal just to reach additional populations? Is this really an effort to try to reach marginalized groups, people who have not perhaps been showing up to get testing at the other existing sites?
Yes, that's definitely one of the reasons.
Thank you.
Okay, thank you, Christine. So I think that concludes my list. I'll give a 5-second count if anyone has one last question that they want to get in.
I did want to ask about the existing disparities in the data for COVID-19 in Champaign County and what explains, the larger population of Latinos, Hispanics, and African Americans compared to what's represented in the population.
A lot of our current numbers have to do with the large outbreak that we're having at Rantoul Foods, which has been in the media a lot. And we also have about 18 other smaller outbreaks that we're working on. These are involving people who are currently working at the essential work sites that are open now. So that could be anything from a restaurant to a grocery store to manufacturing to, the pork processing plant to anything like that. Once we get a positive case, what we do is do a case investigation, do contact tracing, and then with the contact tracing, we get everyone associated with them offered testing. So that is going to, especially homes, if you get into someone's home and they refer in their family members and they've been living together before they even knew they were sick, there's a high likelihood that they're going to be infected as well. So that is what we're seeing. This virus is definitely traveling along networks. Once it gets into a community, then it can continue spreading. So if you are someone who's positive from you get infected at your job, you go home to your family members can get infected, and then if they have been going to work, then they could also cause an infection at work too. So this is why, even with all the testing that's going on, it is critical that everyone at their employment make sure that they are practicing and being very vigilant about infection control practices. We have noticed that there seems to be sort of a belief out there that you might get infected by the general public, but then they're not thinking about coworkers. Your coworkers are just as likely to be infected as anyone else. So that means that even though you're doing your job and you're wearing your mask, if you go out on break, you need to wear your mask. If you're riding to work with someone, you need to wear your mask. If you are, going to lunch, everything like that, you need to make sure that you are maintaining distance and wearing your masks at all times.
Thank you.
Patrick, if I may.
Oh, sorry.
Yes, sir. Go ahead.
Yes, I just wanted to put a reminder in here at the end that today we're welcoming the media out to the test location between 1 and 4 p.m. We'll have our public affairs team out here that'll be able to walk them around and let them see a little bit of the team that's actually going through practicing and prepping for tomorrow's opening. Thank you.
And thank you. And yeah, that's right. So anyone from the media who's interested in participating in that, I think in the news advisory yesterday, Amy Roberts from Public Health is helping to coordinate that. So if you want to reach out to her, she can help you with that. That will conclude the news conference for today. Just a couple last resources that we always like to mention. 211 is a service provided by the United Way of Champaign County. Anyone seeking local resources, any kind of assistance, can call 211 and get hooked up with a trained specialist. And also Champaign County COVID-19.org is a website you can check daily for daily updates, local information about the local response, additional resources, things like that. So Champaign County COVID-19.org. That is all we have for you today. Thank you to everyone for attending. Thank you to our speakers for giving us the additional details, and we will see you next time. Thank you very much.
Thank you.